heard people as they've gotten, well, more older than younger, start talking about they bleed and they just bleed, and they can't control it. What's going on when people say that?
So there are a wide variety of things that can happen. It's one where there could be something anatomic, meaning something in the uterus itself that's causing bleeding. That can be anything from cervical cancer. It could be a growth inside the uterus, like a polyp or a fibroid. Fibroids are incredibly common, particularly as we age. If you ultrasounded 100 women in their 40s, 80 to 90% of them would have at least one fibroid.
Wow.
It kind of depends on where the fibroid is located as to whether it will cause symptoms. Again, based on age, teenagers can have irregular periods because they're not ovulating on a regular basis. That is very common in the first year or two after you start having periods. Later in life, you may also not be ovulating on a regular basis, but that's because you're approaching menopause. It's possible that you could have a precancer or cancer inside the uterus itself. It's also one where there could be a medical problem going on. Women who have thyroid problems can sometimes come see me, and their main problem is that their bleeding pattern is irregular, or they're having heavy, long cycles. Get their thyroid hormone level under control, the bleeding fixes itself. And so there are a wide variety of reasons that may happen. A lot of them are age dependent. And so when they come in, a lot of times we do tend to check their blood count to make sure that they're not anemic or have a low blood count because of the bleeding. And then it really depends on their age and kind of what else is going on. A lot of times an ultrasound is a great way to get a good view of the uterus. Problems with the ovaries typically do not cause changes to your bleeding pattern. A lot of women become concerned about ovarian cancer, which is devastating but not common, and they see me because their bleeding pattern is unusual and they're worried it's from cancer of the ovaries, and that's not common. It could be cancer of the uterus, but ovarian cancer tends not to have any bleeding symptoms.